Welcome everyone to the ROMA Next Generation video series, and today we're going to be talking about understanding community level work. And this video series for ROMA Next Generation is really focused around implementing the ROMA cycle in the Next Generation Performance Management Framework. And so what we want to talk about today is really digging into an introductory level of community level work and community level change. So this series that you see here on your screen is intended for community action agency directors, staff, board members, and volunteers who are interested in learning about how to help your community action agency increase its capacity and results. So the ROMA Next Generation video series consists of the modules on your screen, and they can really be used in any order. And as far as this presentation that we'll be going through today will briefly introduce the key concepts behind community level work, and accompanying this video module is also a workshop that can be done at the local level to help agencies look at their own work that they're doing within the community, look at their community level strategies as well as the community level needs, and see how all of those are working to produce community level outcomes. And so we hope that you find this helpful as an introduction and consider how the workshop might be useful. The workshop can be used in a variety of formats. So it can be used as a day-long training, it can be used as a half-day, or within other meetings and trainings. So it's really adaptable to the agency's needs, as are all of these in the video series. And so Barbara Mooney and I will be presenting this concept today. And so Dr. Barbara Mooney is the director of the Association for Nationally Certified ROMA Trainers. She's also the co-author of the Introduction to ROMA curriculum, the research for national, also research fellow for the National Association for State Community Service Programs, a consultant to the National Community Action Partnership, regional coordinator for Region 3 Performance and Innovative Consortium, and then also a contributing author to Temple University's Strengths-Based Family Worker Training Curriculum. So over the past 5 years, she's worked on the development of the OCS Performance Management Framework. And then I am Courtney Kohler. I am the Senior Associate with the Community Action Partnership, working under Training and Technical Assistance. And previously I was with the Missouri State Association and was certified as a ROMA trainer in 2014. So as we start off today talking about community level work, we want to look at assessing the needs. And so when agencies conduct their community needs assessment, they identify the causes and conditions of poverty that might be unique to their own community. And Standard 3.4 really looks at how the community assessment includes those key findings on the causes and conditions of poverty and the needs of the communities assessed. So this is really the first step in community level work, is assessing the needs and really looking at that community level. So as we talk about levels of need, there's a couple different levels of need. So there's the individual or family level. And within this level, the situations are identified as being particular to a specific group of people. And so this might be families with low income, as they need assistance in preparing their children for school. It might be vulnerable senior citizens or adults with disabilities that cannot care for their homes or accomplish their tasks. Or it might be working age adults that don't have skills required for their living wage jobs. So of course, most of these needs are going to be found within many communities across the country. And then we also have community level needs. And so these are situations that are identified as being systemic in the community and really impacting the community at large. And so it might be that the Southside neighborhood does not have early childhood programs, or that the percent of the community that is made up of vulnerable senior citizens is increasing, or maybe there are limited living wage jobs opportunities within the community. So these are things that can be found across the country as well as that more systemic level. So then once those needs are assessed, you want to look at making a plan. And the key to developing a strategic response to the community needs assessment is in demonstrating how the biggest needs are being addressed by the agencies. And so as local agencies move towards making strategic plans, They use a local theory of change and their mission statement to really guide them and identify what actions that they'll do over the next year or maybe 3 or 5 years. So they will consider the findings of the community needs assessment. And so oftentimes we see a disconnect with this, and the community level needs are identified, but the family level services are those that are planned. And so we want to make sure that all of this is being connected from the level of need to the outcomes and strategies. And so Standard 6.2 looks at the idea that the approved strategic plan should address reduction of poverty, the revitalization of low-income communities, and or empowerment of people with low incomes to become more self-sufficient. And then Standard 6.3, which this is all in the strategic planning category, is that the approved strategic plan contains family agency and or community level goals. And of course, that those are connected back to the community needs assessment as well.
Thanks, Courtney. It's important to know some of those basic concepts of whose need is it as we start to look at community work. So I'm going to talk a little bit about what we've been doing and how the local agencies have been reporting on how they've addressed those needs at the community level. Historically, there have been only a limited number of community action agencies that have reported on the community level results. The conditions in which low-income people live are improved is the goal that we've been reporting on. And you'll see these low numbers here, 28, 17, 24. Those are the percent of the local agencies that reported on those in the 2015 report. So these are from 2015 report data. You'll see that the large number is the weatherization program reports that weatherization has rehabbed homes in the community. The other, access to affordable health care services, access to child care services, these are all also very low. And we're talking about access to services here. And we see that agencies haven't reported very strongly on these areas. Finally, we look at a few things like increase in community assets, changing community facility, changing the availability of community facilities, or are improving public or health safety. So there are there are very few items being reported on. And so we asked the network why they were reporting they were reporting so rarely on these community level indicators. And we found two main reasons. The first was that the national performance indicators really didn't capture all of the community level work that was being done, and that it takes many years to reach an outcome. And so an agency may report only once in 3 or 5 years. Say someone is helping to create a community center, it might take several years for that, and then they would report one community center in the final year, so that would make the reports low. So there was an effort to address both of those issues. And at the same time, we really are looking at what's meant by increased assets. So the network is really being challenged to think about how they think about the expansion or the counting of assets in the community. Sometimes the agencies have gotten a grant and they've developed programming, developed a project, they manage as long as there's funding available, and that is an increase in assets. But there's been quite a bit of discussion about this kind of project. Is how has that engaged the community? What is involved in that asset? And many of the professionals in helping programs see this as a strategy, that we've created these assets for a bigger purpose. So you'll still see that counts have changed in the new annual report, but we're being challenged to think beyond that, to think what was the purpose of the asset, what happened because of the asset. If you increase the number of jobs, did that decrease unemployment? If there are additional housing units available, does that increase the percent of families that are able to afford housing? How does the weatherization of housing units really change the nature and the stability of the community? And then really, how does the creation of a new facility impact the community? What happens in that facility? What's really changed for that community? So we've come up with these 3 key elements to define what is community level work. That we start with a clearly defined community need, that we have an expectation that there will be a community change that can be observed, and that there are community strategies that include those that are outside the community action agency. We're going to talk about each of those a little bit here. I'm going to pass the presenter role back to Courtney.
All right.
Talk more about community level work.
All right. Well, thank you, Barbara. So the first step that we talked about whenever Barbara just went over those key elements of community level work was really around identifying and verifying the need. And so we need to be able to support the need with data and analyze the factors that are related to that need. And so as we identify the need, we ask questions such as, how do you know there is a need? So the sources of finding out what needs you have are from your community needs assessment, or maybe from other sources that you might have. So we talked about the CNA process, or the community needs assessment process, as identifying needs, but we also have other ways to identify the needs. So if we notice a large increase, for example, in the number of individuals that are coming for service who have limited English language skills, we take note of that need. So it might be something that's observed. If we see a neighborhood that's beginning to fall into disrepair, we take note of that need. Or if we hear customers worry about the lack of access to fresh food in their neighborhood, then we take note of that need. So the next piece of that is not to just identify the need, but really to establish a strong need statement. And so the statement of need identifies or establishes the focus and rationale for the project. So it needs to be concise and coherent, and it needs to be easily understood by the general public. And if you don't have a compelling need, then you don't have a compelling project. And so all of those pieces are connected. And whenever we talk about it being concise, we really want it to stick to the main point of the need. And whenever we talk about it being complete, it really needs to include everything that's needed to clarify and define the problem or situation, so that that meaning or context is not lost along the way. And then whenever we talk about it being coherent, we want to provide a logical case for the situation, being something that's important and urgent for the community. And then also we want to clearly state why we know that it's a community problem. So we might have comparison data to contextualize the need, and this comparative data can be really telling. So an example would be that the poverty rate for a certain county is 15%. This might not be as meaningful if there's no context to it, but if it's clearer, and you might say the poverty rate in our county is higher than the state and national rates, ours is 15% compared to 12% of the state, or 12.5% nationally, then that provides it with a little bit more context. And so that can be very important to be able to clearly state what the problem is. Also providing qualitative and quantitative data to then support the need. So making sure our data that we have is current and relevant to the topic, that it doesn't confuse agency needs with community needs, and also it doesn't confuse the individual and family needs with the community needs. So some of the key points in identifying the need. We want to make sure we don't assume that everyone knows the circumstances or conditions that prompted the project. We also don't want to editorialize or bring in emotional peers. appeals. So we want the data to really help focus in on the facts. Also, we want to make sure that the statement of need has local data. So whenever community action agencies were put into operation back in the 1960s, it was really based around those local needs. And so we need to focus on that local data to be sure that we're able to appropriately address what's happening in that specific community. And so the need or problem may be a national problem as well, but we want to make sure that we're establishing that the local problem with the local causes and conditions behind it through that relevant data. And then we want to make sure that our data is up to date so that it's current. Another thing we want to do is we want to make sure we avoid circular reasoning. So sometimes we think that just identifying the absence of something can be identified as a problem. So an example of this would be that the problem is we have no youth center, so the solution is to build a youth center. But why do we want a youth center? And so you want to kind of ask through some different questions, such as what makes you think a youth center is needed, or that would address the problem? Or what data will back up your identification of this as a need? So is it really a need that there is not a youth center, or is there something other focused around youth that needs to be done? And so what will change because there is a youth center? So making sure that you're asking the appropriate questions to make sure you're avoiding this circular reasoning. We also want to ask, whose need is it? So we want to identify what or who is the target population that we feel needs the agency's help. And then also, what are the demographics and conditions of that population? Because this can be really important whenever you start to identify strategies to address the need. If you're not addressing the right target population within the need, then your strategy is not going to be as effective. And so being as specific, concise, and clear as possible in articulating whose need it is can lead to more change in the community further on. Next, we want to make sure we're gathering and reviewing the assessment data. And so we've talked about different types of data, but just to review here, that qualitative data is really kind of those, the narration and really kind of explores things. So what do people tell you about the need? That's coming directly from customers. And who are the people with the need? What is important to them? So it's that kind of data that really explores and gets information directly from the people. Then the quantitative data is really those statistics and numbers. And so you're looking at what statistics verify the need, you're looking at how recent is the data, what is the scope, also is there concentration in one neighborhood, so geographic data, as well as is it one segment of the population or another. Then also we want to make sure we understand the components of the need. And so we're going to refer to a factor or an element. And by saying that, we mean it's a circumstance, a fact, or an influence that contributes to a result or an outcome. And it also has the potential of affecting a trend line. And so identifying the components that are impacting a trend line will help get to the root causes. And identifying and understanding these factors or elements will help to drive that strategy selection and development. So these elements can be found, for example, by asking the 5 whys. And so it's really about asking those questions. And also digging deeper into the problem to find out what's behind the obvious conditions that you see is going to be key to really understanding these components. And so another piece is we look at what factors have been known to influence the causes or conditions. And so we're asking questions such as, what is causing the story in the trend line? Or what has made a difference in the past? We also want to know, what is our evidence? And so whenever we're asking these questions, we're really looking at these factors. And so there are 2 kinds of factors we are looking at. There's both restrictive and contributing. So the restrictive factors are looking at the decrease in the desired result. And then the contributing factors are looking at the increase in the desired result. And so whenever we're looking at this, making sure we're looking at both different kinds of factors to really see what is influencing those causes and conditions. So So with that, I'll turn it over to Barbara Mooney, and she's going to walk us through step 2.
Thank you, Courtney. And now we're going to look at identifying outcomes. Really, to be able to think of a community level outcome is at the heart of identifying what is community level work. If you're getting together a coalition to address a certain problem, and what will happen is that there'll be an increase of services to individuals, that doesn't necessarily mean that you've made a change in the community. So we want to always be thinking about the results being in the center of all of our work. We're results oriented, and so we need to focus on identifying those results. What will change in the community because of what we've done? Will there be a change in systems or policies or practices? And we'll talk a little bit more about how we measure those outcomes in just a minute. The next thing to do is to identify what will happen. What will the agency do? So we're looking at strategies. And note that we use the term strategies at the community level, and we talk about services for individuals and families. So we're going to think about identifying strategies that will address a community level need. Here's a big problem. Watch out that you're not jumping quickly to a strategy before you really understand what you want to change. So we've identified a need. Okay, let's think of how we might solve that problem. You really need to think first about the outcome that you're going to address, and then to work on the strategy. And don't confuse your work tactics with strategies. You might say, oh, we want to do a common intake in our agency. Well, that's really a work plan or a local agency tactic, but it isn't really a community strategy. So you have to really think about what it is that you're doing and how it really will focus on the community level. So you'll first pick a focus factor, one of those factors that Courtney talked about that either contribute to or restrict the accomplishment of your outcome. And then you clearly articulate the expected community level outcome, and only then do you start to identify strategies. In the new annual report, there is a list of strategies, and so this is a new piece in the annual reporting process. And it will help us to really think about and define what we consider to be community level work. So remember that there are many different activities that will be done as part of an initiative. Different partners will be doing different things, and some of those activities might be direct services to families, but they're identified in a comprehensive strategy that says how each of the pieces of the strategy work together to bring the unique strengths and resources of the partners to bear on the need. And this is what we call mutually reinforcing activities. This is an element of the collective impact approach to community level work. And it's important to think about because this says that the power of collective action comes not from the number of participants or even from the uniformity of their work, but really from the coordination of their different activities. So as I said before, that each of your partners has a strength, and we want to bring those strengths to bear on the need, and so we want to coordinate those activities in a mutually reinforcing way that ensures that the efforts and activities of the collaborators are aligned forward towards a common agenda. We're going to talk a little more about that when we think about measuring. And here's the next step is really to identify what we're going to measure. As I said in the past, there were only a few community level indicators, and in the new annual report, there are a lot more community level indicators identified. There are community level indicators identified in each of the domain areas that are identified in the National Theory of Change. And so there's a wide range of ways that you can report on your community change. And there are two different pieces of that annual report section. They are counts of change and rates of change. And we'll talk more about that in the workshop. How do local agencies get credit for what they do? This is one of the hardest pieces for our network to grasp, and indeed from community level work in general across the network, or across human service providers in general. How does my contribution get credited when there's a big change? So if we've reduced the unemployment rate, what does my little part have to do with it, and how do I get credit? So we're going to refer to a couple of things. This idea of a well-constructed plan, that your plan for your initiative clearly defines what you will do and what each of the other partners will do to contribute to the overall goals. And one of the places in the annual report that this plan will show up is on the community initiative status form. And you'll be able to say what activities that your partners will be engaged in and who your partners are. So as you work through the plan, if you fulfill your designated role and if the initiative moves forward, then you're going to be able to report those successes in your own reporting piece. And we'll talk more about this alignment of actions in the quest for the community level goals as we work in the workshop. But one way to think about this is this theory of aligned contributions that's part of the Annie Casey Foundation leadership and community work, is to think that all of the partners want to be moving forward, and they have to identify the conditions that really will bridge the gap between what the current reality is and what they see as the desired results. So the population level change are most likely to occur if this group of cross-sector agency leaders take aligned action, that they line up the activities that they're going to do to focus on the goal. I'm going to turn back to Courtney for her to bring it all together.
All right, well, thank you, Barbara. And as we bring it all together, we really want to consider, is it community level work? And so looking back at the steps that we went through as far as identifying the need, the outcomes, and the strategies, and how all of those align to create community change, we want to make sure that if it is community work, that's how we're using it and counting it, and vice versa if it's not. So again, the community level work must have those three things. So it's a clearly identified community level need, the expectation of community change that can be observed. So this is also the knowledge of how it is observed and measured. And then also the community strategies that include those outside the community action agency. So not just an internal tactic, as Barbara was mentioning. So this might include your customers or others in the low-income community. So these are the three key elements to community level work. And so as we alluded to in the beginning, there's also an accompanying workshop with this video module that really digs deeper into community level work and has some hands-on activities to start kind of practicing with these three elements we've discussed today. And so we invite you to participate in this workshop or facilitate it to your agency or network. So these workshops can be available for certified ROMA trainers to facilitate or others within your agency that have facilitation experience and want to provide this for your agency or for your state network if you're a state association. And so with these workshops, we really want to have you all consider the community level work that you're already doing or those things that you've talked about, so that you have those real local agency examples to work with. And so all of this will be located on the Community Action Partnership website under Tools and Resources. And so you can access all of the Roma Next Generation video modules there, as well as the PowerPoints that are associated with these visual modules, the PowerPoints that are associated with the workshops, and within those, there's also a facilitator guide. And so go to communityactionpartnership.com, Tools and Resources. And of course, for more information, feel free to contact any one of us, either Barbara Mooney at the Association for Nationally Certified Roma Trainers, or myself at the partnership, as well as some of our other colleagues such as Tiffany Marley or Joel Crocker. And so we appreciate you tuning in to this video today and learning about community level work. And please let us know if you have any further questions. So we hope you have a great day.